When you think of an annual exam, you're probably thinking of a physical, but something just as important as a full body exam is an eye exam. Here with more insight is Dr. Richard Levin of Total Vision, Maryland. Dr. Levin, thank you so much for being here.
Thank you.
Okay, so walk us through the first visit of an eye examination. What can we expect?
Absolutely. Anytime a patient comes in for a routine eye exam, they should have a refraction, which is a normal patient would recognize as a glasses check, as well as an examination of the anterior segment, which is an examination of the cornea, iris, and the lens. And any good eye exam will have a dilated retina exam, where we examine the structures in the back of the eye to check for eye diseases as well as systemic diseases as well.
So oftentimes you're not only looking to see if they need glasses, it's even more important sometimes to see about looking for disease.
Absolutely. We pick up on many eye diseases the patient never knew they had, such as glaucoma, diabetes, high blood pressure, holes, tears, detachments. Unfortunately, we see that all the time.
And obviously not a disease, but still a problem nonetheless, is dry eye. What is that from and how can we treat it?
Absolutely. We've noticed an explosion with dry eyes due to the increased use of computer screens. So dryness is a chronic issue. We can't just give you one thing and it goes away, but the standard treatment is a usual over-the-counter, non-preserved artificial tears. But if that doesn't work, we can move on to Restasis, which is a prescription eye drop, as well as punctal plugs, which are these little plugs that we can insert into the puncta of the eye so the tears will stay on the eye and not drain into the nasal cavity.
So for redness and for dryness, because sometimes we get like, you know, it covers all bases, it's the over-the-counter drops. Is that okay to be using on a daily basis?
I would use a regular non-preserved artificial tear. I would not use anything that says take the red out, because that will actually constrict the blood vessels and will make the eye look redder and will actually become drier in time.
Is there any chance, I've heard this and I don't know if it's true, you can tell me, that your eyes will become addicted to needing these drops? Is it only the ones that say take the red out?
I wouldn't say addicted, it's not a physical addiction, but when it constricts the blood vessels, people like the whiteness that it offers their eyes, but there's other ways to achieve that healthy eye, and it's not by using a drop that says take the red out.
Okay, and what about for people who are wearing contact lenses? What are the issues that they're facing with dry eye and how that can be treated?
Absolutely. For dryness, we recommend two different types of lenses. The newest lenses on the market are the silicone hydrogel lenses, which are very high Woodard oxygen lenses, which are good for patients with dryness. But we use in my practice is we recommend a daily contact lens that you throw away after every use. So you don't need to clean them, there's no solution, there's never a risk of an eye infection, and those lenses are also mixed with an extra wetting agent, so they're very good for patients with dryness.
Sounds a little expensive, no?
You would think that, but it's actually only about an extra $50 or $60 per year for that type of a lens, and the risk is if you wear a regular lens and you have an eye infection, that $50 you might have saved getting that monthly lens, you just lost coming back for the eye infection with a copayment.
Right, so it's worth it, okay.
Absolutely.
All right, thank you so much, doctor, we appreciate it. Great information.
Thank you.
Keep your eyes healthy with help from the knowledgeable staff at Total Vision, Maryland. Make your appointment today by calling 410-486-1010 or look them up on the web at totalvisionmd.com.